Acute coronary syndrome, or ACS, is a set of one or more conditions that cause the blockage of blood flow to the heart muscles, resulting in a myocardial infarction, or MI. The heart is a muscular organ that pumps blood, containing oxygen and nutrients, to the rest of the body. The left ventricle is the main pumping chamber of the heart, and contracts to send oxygenated blood to the rest of the body through the aorta. Several smaller arteries, known as coronary arteries, are connected to the aorta and supply the muscles of the heart with the necessary oxygen and nutrients. In acute coronary syndrome, there is a blockage in the blood flow through the coronary arteries, usually due to an atherosclerotic plaque, a coronary artery spasm, or a coronary artery dissection. In atherosclerosis, the continued deposition of a fatty plaque results in the narrowing of the involved coronary artery. Rupture of this plaque results in the formation of a blood clot, thereby causing a blockage of the involved coronary artery. The formation of a blood clot is the most common cause of a coronary artery blockage. Other less common causes of coronary artery blockage include a coronary artery spasm, which is triggered by drugs, smoking, cold weather, or extreme stress, resulting in a sudden tightening of the coronary artery, or a coronary artery dissection, in which the inside wall of the coronary artery separates, resulting in a blockage to the blood flow. Such a blockage to either of the coronary arteries results in oxygen and nutrients failing to reach the part of the heart supplied by it, causing the death of the heart muscle, a condition known as myocardial infarction. Symptoms of a blocked coronary artery include sudden pain or discomfort, tightening, or a burning sensation in the chest, known as angina, which may extend to the upper abdomen, shoulders, arms, neck, or lower jaw. Angina occurring at rest or as multiple episodes, preventing even moderate physical activity, is known as unstable angina and is commonly observed in acute coronary syndrome. Other symptoms of acute coronary syndrome include 1. Breathlessness, 2. Dizziness, 3. Sweating, 4. Nausea. Treatment of acute coronary syndrome, or an MI, usually involves the following. 1. Oxygen therapy, to increase the amount of oxygen delivered to the blood and heart. 2. Aspirin or antiplatelet therapy, to prevent blood clots. 3. Thrombolytic therapy, such as TPA or streptokinase, to break up existing blood clots. 4. Nitroglycerin and morphine, to relax the coronary arteries and relieve the pain. 5. Beta blockers, which reduce the heart rate, thereby decreasing the oxygen requirement. 6. Coronary angioplasty, an interventional procedure in which a balloon-tipped catheter is inflated inside a blocked coronary artery to open it, with a stent remaining behind to keep the coronary artery patent. 7. Coronary artery bypass grafting, or CABG, pronounced as cabbage, a surgical procedure in which the blocked coronary artery is bypassed with a vein or artificial graft material in order to re-establish blood flow to the heart.